Okay, this is my persuasive speech, and here are my audience members.
How are you?
And got everyone. And I'm going to be passing around my phone, which has my PowerPoint presentation on it. And then I'll also have my PowerPoint presentation on the screen in the video. Okay, let's begin. My speech is called Let's End Substance Abuse in California. Good afternoon, everyone. Who is tired of witnessing the tragedy of addiction all around us? Today, I am here to talk about substance abuse in California. I will recite some shocking but true statistics from many credible sources, such as the California Healthcare Foundation and more, and hopefully convince you all to put an effort towards doing something about it. Substance use is a problem in many ways. There are two main causes, and luckily, there are many potential solutions. Before talking about causes and solutions, let's establish the problem. Firstly, I would like to draw your attention to the problem that is substance abuse in California today. I will be telling you about the problem of the homelessness epidemic as it relates to substance abuse, economic problems, and social problems involving substance abuse. To start, I will tell you about the problem of substance use in the homeless community. According to a report titled Mental Health Care for the Homeless, Who Cares?, written by the Sacramento County Grand Jury from the report period of 2022 to 2023 and posted on sacgrandjury.org, quote, homelessness in Sacramento County has ballooned 253% in the last 5 years, end quote. They also reported that, quote, among the nearly 10,000 men and women who sleep on the streets each night, between 50 to 80% of them suffer from a mental illness and or substance abuse. Next, as someone who has personally recovered from being a longtime fentanyl and meth user who has been to rehab many times, I can tell you more often than not, people who use drugs also have a dual diagnosis such as a mental illness, which can sometimes even stem from the drug use itself. But you don't have to take my word for it. There's an article titled Dual Diagnosis. This is published by the Cleveland Clinic on clevelandclinic.org, and it was last reviewed on 11/8/2022. It says that, quote, dual diagnosis conditions frequently occur together. Researchers have found 50% of people who experience a substance use disorder in their lives will also have a mental health disorder, and vice versa. Secondly, I want to point out the economic problems related to drug abuse. First, the cost of providing treatment to citizens is very high. Posted on publichealth.lacounty.gov, the County of Los Angeles Public Health and Substance Abuse Prevention and Control created an SAPC data brief titled Costs of Alcohol and Other Drug Misuse and Abuse in April of 2024. Now, this document states that California spent 19.5% of its budget, or in other words, 2 cents per dollar, on substance abuse prevention and treatment. They also state that, quote, people with substance abuse disorders have 2 to 3 times more medical expenses than people without them, end quote. Oops. Sorry. Technical difficulties. Second, the cost of drug-related arrests moving through the court system have gotten increasingly higher throughout the years. There's a report titled California Drug Courts, a Methodology for Determining Costs and Benefits on courts.california.gov, and it is headed by project lead Francine Byrne, MA, and states that there are currently well over 1,000 adult drug courts operating in all 50 states. Over 12% of these is located in California. End quote. They also claim that these drug court programs have cost federal, state, and local taxpayers billions of dollars in total. It goes on to say that although locations such as LA Central and San Joaquin have shown net benefits from drug court participants having positive outcomes, they also have high costs associated with these outcomes. Thirdly, I want to tell you about the social issues of substance abuse. The stigma of addiction affects all Californians in one way or another, or at least most of us. For people suffering with a substance abuse disorder, stigma surrounding the subject is a key barrier from prevention, intervention, and treatment. For people that don't have a substance abuse problem themselves, the stigma attached creates a separation between them and the one suffering. Stigma hinders the possibility of people having the courage to seek treatment, could encourage isolation, and even prevent people from acting in order to save a life in some cases. Also, substance abuse in communities can affect our children and young people. Children are impressionable, and if they are exposed to certain behaviors and actions related to drug use, it could have an impact on them. This could lead to getting bad grades in school and even more severe physical and psychological issues when they become older. In summary, the main problems involving substance use in California are homelessness, economic, and social problems. Now that I've explained the aspects of the substance abuse problem in California, I will go into explaining some main causes of the problem. Two main causes of substance use in California are the rates of unemployment and the availability of substances. The first cause I would like to point out is the unemployment rates in California. There's an article, and it's titled Substance Use in California Almanac 2022 edition, and it was published on January 27, 2022 on the California Healthcare Foundation's website, chcf.org, and written by Allison Valentine and Molly Brazil of Aurora Health Group. This states that, quote, the death rate from fentanyl increased tenfold from 2015 to 2019, end quote. And also that, quote, amphetamine-related emergency department visits increased nearly 50% between 2018 and 2020. As a recovering addict who spent over 10 years of her life doing the same things mentioned in these statistics, I can tell you with confidence that holding down a job or even looking for or obtaining a job is next to impossible when using these substances. Even if you have a job when you start using, losing that job is almost always inevitable, not only because it takes all the money you make in order to keep your habit going, but also the high highs and low lows that naturally come with addiction. Secondly, the availability of these substances is so vast that it's increasing usage rates and associated problems with use. According to the article titled Opioid Epidemic, Addiction Statistics, and this was published by the National Center for Drug Abuse Statistics on drugabusestatistics.org, no date, the number of deaths from opioid abuse in California each year is 2,400. Also, prescription opioids are involved in 45.2% of deaths, and doctors write enough of these prescriptions for 45.7% of all people to have one. Also, drugs are becoming more available, not less, not only through illegal smuggling, but also from our own doctors on California soil. To conclude, the main causes of the substance use problem in California are the unemployment rates and the availability of substances. Now that we have learned about the problems and causes, let's talk about a solution. You can personally help curb this crisis today by participating with organizations or all on your own. First, let me tell you how you can participate with organizations to help the cause. The Sacramento Opioid Coalition is now accepting new members to help raise awareness to provide education on the subject of opioid addiction, provide free Narcan and training to the community, and provide resources to recovery centers. To join, go to sacopioidcoalition.org or email info@sacopioidcoalition.org. Narcan, a life-saving overdose reversal medication, can also be handed out or carried by someone like you. Any community organization can apply to participate in the Narcan distribution project today. I challenge you to propose this to your own local community groups. The second way you can help is to simply be kind to... wrong slide. Lastly, there are things someone could do all on their own to help combat the epidemic. One way you can help is by printing downloadable pages from NA or AA literature, or pick up books that are NA or AA official literature and pass them out around places that are known to be common places to find addicts, such as homeless shelters, social services office, or parks. The second way you can help is to simply be kind to everyone around you, even strangers, because you never know who could be a suffering addict who needs a smile or kind words in order to gain the strength to go on. Now that I've told you how you can help with organizations or all on your own, that brings me to my conclusion of this speech. In conclusion, there is a problem of substance abuse in California. There are two main causes of this problem and a few ideal solutions to help combat the problem. Both adults and youth in our beloved state are suffering every day from the disease of addiction, and they need the help of everyday citizens like you and I now more than ever. Will you do more to help these people today?
Sure.
Yes.
Okay, that concludes my speech, and I will stop recording right now.